Hello everyone and welcome to AceOSCE's case for today. Today we'll have a little of a different case. We usually see patients coming in for advice and we give them their advice and they go on their way. But sometimes patients do come to us when in cases where we do not have the answers to their questions and we do need to refer them to their doctors or to specialists or other allied healthcare professionals. Let's have a step-by-step walkthrough for such a case today. Today, when you stand outside your OSCE door, you see the following note. A patient is coming to you with a concern. Do as you would in your regular practice. Remember, you get this cue note outside your OSCE door and you can read it for about 10 to 15 seconds. Use this time wisely and make a mental note of what sort of language you're going to use, what your body language is going to be. So in case it's a patient coming in, you do want to be empathetic. You want to use layman, regular language so they can communicate with you and they can understand your answers and advice better. In case it's a professional, it'll be a little more professional, more medical lingo and things like that. So use this time wisely, especially if it's a patient case. Quickly write down DOSAM, DOSAM, which stands for any sort of drugs, any sort of other medications, any side effects they're having, any allergies that they have developed, or any medications that they're taking over the counter. So we can quickly go through that with the patient and let's enter the door. Once you do go inside the door, you'll have about 20 seconds to give your barcode to the assessor, have a seat on the OSCE table, and have a look at the references and the patient profile in front of you. Again, use this time wisely. And once the person does come inside the door, be it a doctor or a healthcare professional or the patient, which is in this case, make sure that you stand up, have a smile on your face, greet them, acknowledge their presence, and make them feel welcome. Good morning, sir. My name is Tina, and I'm the pharmacist on duty today. How could I help? Hello, Tina. My name is Robert. I picked up a blood pressure medication from your pharmacy a few days ago, and I'm just a little concerned about it. I'm sorry to hear that, sir, and I would really like to help you out today. Please have a seat, and I'd appreciate if you could let me know a little bit more about your concern. Yeah, so I picked up this medication. I think it's called the amlodipine something, and it's about, I think, 5 milligrams in strength. I was hoping to see why I'm having this bloating feeling in my legs. Ever since I've been taking it, it's just a nuisance. I wasn't told that this could be a possibility taking this. I don't know if it's because of this medication. I just think I want to stop it. Can you help me out? I'm so sorry to hear that, sir, and I would really want to help you out today. I will have to go through your profile with you quickly to make sure why this is happening and to give you a better informed answer. Is it okay if I go through your profile with you quickly? Yeah, for sure. I just wanted to know why this is happening. I totally understand, sir. Are there any other questions you have for me today? Yeah, I just want to know if I can just stop taking it right away. I don't really want to keep taking a medication that is potentially giving me side effects. For sure, sir. Please give me a few minutes. I'll quickly go over your profile with you first, and then I'll have a quick look at my reference to give you a better answer. As per my records, I see a Mr. Richard Allen, with the date of birth is 23rd September 1972. Is that yourself? Yes. Okay. I don't see any medical allergies, and your current medications are just the Ramipril 10 milligrams, amlodipine 5 milligrams, and the colchicine 0.6 milligrams. Is that all you take? Yes, that's all I take. I see that your amlodipine has just started a few days ago, and your other medications have been filled for more than 2 months ago. Seems like you're more stable on those. Is that right? Yeah, I've been taking the Ramipril and the colchicine for a long time. It's only the amlodipine that I started recently. I just don't know why this is happening to me. I really wish I wouldn't have taken those medications at all. Oh, I'm really sorry to hear that, sir. And believe me, I'll try my best to go through my references to give you a better answer for your questions today. Please give me a few moments as I look through my reference to give you a better answer. Now we quickly look into our reference. Our reference could range from a few pages long to just one sheet of paper. In this case, we have a drug monograph of the amlodipine 5 milligram or the package insert. We do want to quickly look through all the sections so we can see where we can find the answers for the patient to give him a better consultation. In one of the options or one of the pages here, or one of the sections, you'll see that it does list edema or fluid retention as a very common side effect of amlodipine. It also states that if this medication causes this side effect for more than 1 week, you do want to contact your doctor in order to get assessed and probably get the medication either changed or a dose increase or decrease depending upon whatever the doctor assesses. So at least we know now that this medication is the root cause of the angioedema most probably, and a checkup is valid if it is the case for about a week or more. In order to answer the second question, let's go through the reference quickly again and try to find the answer to if he can finish or stop his amlodipine right away. On the topmost section, you will see that it clearly specifies that if you stop taking amlodipine, your condition may return if you stop using the medication before you're advised by your doctor. So that answers the second question, that the patient himself should not stop taking amlodipine right away. Instead, he should be referred to his doctor for further assessment, and then the doctor can give him a better idea of what to do in the case it's causing the same. Thank you so much for waiting there, Mr. Robert. I appreciate your patience today. As per my reference, it clearly states that amlodipine has a common side effect of edema or water retention, something that you're experiencing. I apologize in case the pharmacist on duty at that point was not or did not by any chance tell you about this, but this is quite a common side effect. And in case my reference does state that in case it is bothersome to the patient for a week or more, it is a good idea to touch base with the doctor to make sure it is still the best product for yourself. In order to answer your second question, in case you want to stop using the amlodipine abruptly, it may cause the condition to come back. I wouldn't recommend you to stop taking it on your own. I'd rather that you have a quick appointment with your doctor. Even a phone chat, if possible, with him would be a good idea. And once they assess you and give you a better answer, that would be what we want to follow up with. Do you have an upcoming doctor's appointment, sir? Yeah, in fact, I'm actually going to see him this afternoon. I had a follow up appointment with him. That sounds perfect. Maybe let's have a quick discussion with him. And if you'd like, I can also fax your doctor a little summary of our conversation today. So he has it on record and he's prepared to give you an answer once you go see him. Yeah, that would be great. Thanks you for your assistance today. I really appreciate it. Thank you for coming in, sir. Do not hesitate to contact us in case of further questions.